Good afternoon and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. Here are some of the highlights. As COVID-19 cases continue to rise globally, how fast is the race to a vaccine, which normally requires years of testing and additional time to produce at a scale? A pharmacist joins us for more on COVID-19 treatment. Bauchi State government banned Salah festivities in the state due to the coronavirus pandemic. And global coronavirus cases continue to rise. Just last night, the Nigeria Center for Disease Control (NCDC) confirmed 624 new cases and 8 deaths. Till date, 41,804 cases have been confirmed, out of which 18,764 cases have been discharged and 868 deaths recorded in the 36 states and the Federal Capital Territory. The 624 new cases are reported from 17 states and the FCT Lagos with 212, Oyo 69 cases, Niger 49, 37 in Kano, Osun recorded 37 as well, 35 in the FCT, 34 in Plateau, 33 in Gombe, 28 each in Edo and Enugu states, 17 in Ebonyi state, 10 in Delta, 9 in Katsina, 8 in Ogun state, 7 in Rivers, 5 in Ondo, 4 in Kaduna state, and 2 in Nasarawa state. In terms of testing, the national figures of COVID-19 samples tested stand at 267,842. The nation has activated about 60 laboratories, but in 24 hours alone, about 1,519 tests were conducted. And in 24 hours, 62 patients from different treatment centers across Lagos State recovered from COVID-19. 19 of them are females, 43 males, including 11 foreign nationals, which were discharged from the isolation facilities to reunite with society. A breakdown shows the number of patients and where they were discharged from in terms of the treatment centers. 22 from Etiosa, that's Landmark, 7 from Unikon, 10 from Mainland Infectious Disease Hospital Yaba, 2 from Gbagada, 4 from Magidingbi, 17 from Luth Isolation Centers, all discharged after full recovery. Now, as of the 26th of July, 156 COVID-19 infections were confirmed in Lagos. Out of that total, 560 COVID-19 tests were conducted. So that's about a 28% positivity rate. Now, as at that time, the cumulative test for Lagos was at 60,920, with 10,096 recovering in community. But as at today, the figures from Lagos State, the virus epicenter in the country, stands at 14,848, but 12,527 are receiving treatment, while the death toll is put at 192. Let's go over to Bauchi State, where the government has rolled out measures to ensure total compliance to the COVID-19 protocols during the Eid al-Adha celebrations. According to the Deputy Governor, Mr. Babatella, activities like the horse riding and large gatherings have been banned in the state. The government is appealing for prayers to be done at home with total compliance to the non-pharmaceutical measures to COVID-19.
Government have decided that in order to ensure total compliance with experts' advice on COVID-19 and safety advice on social distancing, avoidance of mass gatherings, the use of face masks, Salah festivities like horse riding and other festivities have been banned in the state. So what essentially is going to happen is that, like we did during the Eid al-Fitr festival, people will pray at the praying ground nearest to their communities, nearest to their homes. People need not to come into towns. People need not to come into Bauchi or other major towns to pray. They can all pray in their areas, and there is no horse riding, there is no festivity. People should just pray and then offer their sacrifices to the Almighty Allah. This is in compliance with the COVID-19 protocol of avoiding gatherings, especially large gatherings of this kind of festivities. We believe that doing this will stem the spread of COVID-19 in our community. We have one of the lowest spreads of COVID-19 in the country, and we want to maintain that. If we don't maintain that, we'll put ourselves in positions whereby it is going to be difficult for us to do so. And the traditional rulers, relevant emirs, have already been informed of this decision by government, and they will comply with it.
Now, over in Ekiti State, the state's task force on COVID-19 says disclosure of the positive status of coronavirus patients remains the exclusive right of infected persons. The task force also advised residents against hiding after testing positive for the virus, describing it as risky to society and the persons concerned. Our correspondent, Babajide Agbeyo, brings us this update.
The Ekiti State COVID-19 Task Force has been appealing to members of various communities who may have tested positive for the virus not to go into hiding. The government says it has information that some people are already nursing such plans, which it describes as not safe for the society and for those planning it at this time.
Revealing the identities of infected people, be they members of the cabinet, be they appointees, elected officials, or even the ordinary citizens of Ekiti State. Now, it is against our policy, and I believe any sane health policy, to go about mentioning names of people who might have one ailment or the other. I believe we all know that there's something called doctor-patient confidentiality. Now, for those who wish to disclose their health status, they're free to. Like we all know, His Excellency tweeted his own condition. Immediately he got his results. I believe that's the responsible thing to do, being the leader of the state. He owes the people the duty of revealing to them his health status, which he did.
On high-profile infections, there had been reports that more than 12 aides of Governor Kaude Fayemi may have tested positive for the virus at this time. But the task force says no matter the number being rumored, everyone is at liberty to either disclose or keep his status at this time, and nobody can be stampeded into doing so. No, is the golden advice for both the highly placed and the commoners at this time. Babajide Agbeyo for COVID-19 update.
As COVID-19 continues to spread around the world, people in all countries are being encouraged to take precautions to prevent transmission, including staying at home, physical distancing, and also other measures. In the meantime, researchers around the world are racing to develop a vaccine against COVID-19, with more than 140 candidate vaccines now tracked by the World Health Organization. Now, vaccines normally require years of testing and additional time to produce at scale, but scientists are hoping to develop a coronavirus vaccine within 12 to 18 months. Vaccines mimic the virus or part of the virus they protect against, stimulating the immune system to develop antibodies. They must follow higher safety standards than other drugs because they are given to millions of healthy people. For more on these vaccines and the treatment regimen for the coronavirus, we have in the studio Dr. Oluwatoyin Ojo, a clinical and public health pharmacist, Association of Hospital and Administrative Pharmacists of Nigeria. Thank you for joining us on the program.
Thank you so much, Millicent.
All right. So how close are we in this race for a vaccine for COVID-19 or a treatment that works?
Well, for vaccine development on a normal level, it takes about 4 to 5 years to develop. And there are various stages that the design and development will go through. Clinical initially lab stages, animal studies, and then before you progress to clinical stages involving humans. And so basically it takes like 4 to 5 years. But because of the pandemic situation, it's been expedited for it to be able to come up within 12 to 18 months. So as we speak, there's some level of progress from some pharmaceutical companies. I remember Pfizer brought out information relating to conclusion of a particular stage of the trial. So work is still ongoing, and we're hopeful that something will come out that would demonstrate immunogenicity, ability to develop an immune response in the patients and be able to help with prevention.
So in terms of hydroxychloroquine, because we've heard about it again in recent times, it's resurfaced as a sort of treatment, or some even say a cure for COVID-19, and that's hydroxychloroquine, azithromycin, and zinc. Please tell us, is that still a viable treatment for COVID-19?
Well, as I speak, there is no definitive statement relating to those molecules you spoke about. And the way it runs before you bring out a medication for use in a particular ailment or disease, it has to go through stages of development. So as we speak, hydroxychloroquine happens to be an old molecule that has been used for other indications before now. It's been repositioned for COVID. So we are still in the stages, a lot of researches are still going on relating to hydroxychloroquine. So it would be too early for us to jump to conclusions, because we should talk about evidence-based medicine practice that requires us working with evidence. For that, you have the evidence coming in stages. The lowest level of evidence is what we call the expert opinion, where you find a clinician observing some responses from patients and then coming up to say something. But that's not enough for us to begin to jump to use those molecules. We must take it further by designing studies. You know, studies could be case control studies, case series, and then the gold standard in research is the randomized control placebo studies that would help us to be able to come to a definite conclusion as to usefulness. And then when we are talking about usefulness, it's not just that the medication can bring out positive therapeutic outcomes. We should also look at the safety, because medicine is a combination of two things: the risk attributed to the medication and the benefits. We must be able to strike a balance in the public interest. So it's not just good enough. It's not enough to say it's working. What are the trials that have been conducted? What are the risks that are associated with using the drug? Because those are the things that would inform the manner in which the medication will be used.
But in this case, the WHO has discontinued trials for it. So how do we know from the WHO angle it doesn't work? So why are other countries, and that includes our country as well, with regards to trials for hydroxychloroquine?
Well, the issue about the WHO statement has been a little bit controversial. There has been up and down statements on it. But I believe also that what is important in making a definite statement on issues like this has to do with the data that we have been able to recover from studies carried out. And then the design of those studies is also important, because that's what has influenced the kind of statements or responses that we have had from the research world to some of the data or articles presented by WHO. Some of them have been found to be fallible in terms of the necessary data that should be available. You see, when data is presented, it's important that it's also peer-reviewed. So you need to have the details of that data so that other people can review it and look at the characteristics of the patients that you're attributing cure to. And because sometimes you find that people could just have responded positively because of some other baseline information that we do not have. It may be that they're on some other medication. So just the fact that you experience some outcomes, patients reporting positive outcomes, is not enough. We should carry out data. We should carry out studies that would release and provide us with data that we can review and be able to come to definitive statements of cure or non-usefulness.
All right, still an issue we'll be talking about, but we'd like to thank you so much. Thank you, Dr. Oluwatoyin Ojo, clinical and public health pharmacist. Thank you for joining us on the program.
Thank you so much.
We have more on the global response to the pandemic when we return. Please stay with us. And more states are revising their budgets to meet the current economic realities occasioned by the outbreak of COVID-19. And the Enugu state government is one of the states engaging its citizens on the proposed revised 2020 budget. Speaking during the public hearing, the Commissioner for Budget and Planning, Mr. David Ogunta, says the government has cut its budget from 169.5 billion naira to 146.3 billion naira. He also assures citizens that the budget revised, if approved, it will guarantee the state government's firm footing in addressing their development needs, salaries and allowances, all challenges associated with the COVID-19 pandemic.
Our total budget size dropped by 13.67% from 169 billion 557 million 658,300 naira approved in year 2020 to 146 billion 374 million 641,080 naira. Irrespective of all this, is made in a way that the state will continue to pay the new minimum wage unhindered and also continue to pay allowances as well as health hazard allowances to our frontline healthcare workers for them to continue to fight or maintain the fight against COVID-19.
Well, today is the day that the federal government and other stakeholders, especially the centers and schools, are preparing to write exams, tidy up about the preparedness and safety of their schools. We have joining us from Abuja to talk more on safe reopening of schools for examinations, Professor Titus Ibekwe, an ENT surgeon from our Abuja studios. Thank you for joining us on the program. I have about 2 questions for you. The first is, the federal government has given the go-ahead for existing students to write their exams. The NMA, Nigeria Medical Association, and a few other Nigerians say that it's too soon and they've expressed fears of a spike. What do you think?
Thank you very much, Millicent. The Nigeria Medical Association is correct. If you look at the situation currently in the country, you realize that the incidence in the cases of COVID has been on the rise. It has not been coming down. You look at the attitude of Nigerians also towards the precautionary measures as outlined by the NCDC. You will agree that compliance has not been very encouraging. However, I am going to take the uncharted course of this discourse this morning, which is to say that although all these things will make it obvious for us to say that the school should not be reopened, and even above that, one can further go ahead to recommend that the borders should remain shut as far as the interstate movement is concerned. Public transportation system should not be reopened, both the road, the train, and even the air, because of safety measures, and possibly to say that lockdown should continue. But we know that COVID-19 is a disease of nature and nurture. You must balance life with livelihood, and we are facing reality of the new normal right now, and nobody knows exactly when this incidence, when this disease will eventually leave the country. Taking this course, my personal opinion, I would say yes, putting this into consideration, the lives of our children, very important, but at the same time, also their progress in life is equally, should be weighed to strike a balance. And for this reason, I think that if the children, our children, the students, we the parents, the school authorities, and indeed the government, if we work very closely together, these children may still be able to write the exams within this period. And how do we do this? Number one is that considering the exit classes, especially the SSCE class, you realize that these are semi-adults already. So there are people that can easily obey instructions and understand what the reality on ground is. And this is where we parents will have a role to play to educate our children very well before they leave homes to go and write these exams. And again, we provide the few things that they need, like this face mask. It will not be out of place for every parent to provide 3 to 5 face masks. Make sure you inscribe the name of your child there so that this child will not be able to misplace or interchange with anybody and hand over before they go. And coming to the school itself, the authorities should be made to ensure that the entire facilities within the school are thrown open, not just to go and open a segment of the facilities that they have. Although we have fewer number of students who will be coming in to write these exams, but we will need to utilize all the spaces available in order to be able to achieve the physical distancing that is needed, both in the hostel and in the classroom. You consider the teachers. All the teachers, except those, I would strongly recommend that those who are 50 and above should be not part of this, the revision class that will be taking place very soon. That those who are below this age should be well utilized, and they should also observe all the necessary measures, physical measures that are necessary.
Professor Ibekwe, I must quickly come in here, and if you can, there's a lot of recommendations you've made, but in about 30 seconds, if this is successful, do you see other classes, schools reopening before the end of the year?
Yes, first and foremost is let's finish with the exit class. We'll see how it goes then before we'll be able to consider other reopening, gradual reopening. Because if you look at some countries that really run into serious problems, they went as far as reopening every segment of the classes and every segment of the, the schooling system at the same time, and that became very overwhelming. But if this is observed and we do this strictly, government, they are going to inspect the schools to ensure that the measures that I've asked them to put in place are there. And
I'd like to thank you.
They should ensure that they augment whatever thing that is missing, and also encourage teachers who are going to do extra work within this period.
Thank you so much. It's always a pleasure to have you, Professor Titus Ibekwe. Thank you so much. Hopefully you can join us again, ENT surgeon. Thank you for your time. Now, the World Health Organization is warning of rising cases among young people in Europe. Europe's regional director says increasing infections among young people could be driving recent spike in cases across the continent, and authorities need to communicate better with younger members of society. Here's more on our global update.
The UK has signed a deal for up to 60 million doses of a possible COVID-19 vaccine being developed by Sanofi and GlaxoSmithKline. This is its fourth of such arrangements as the country races to tame the pandemic. No vaccine has yet been approved for coronavirus that has killed more than 659,000 people and unleashed economic havoc worldwide. It is Sanofi and GSK's first apply their experimental COVID-19 vaccine to a country, and British ministers have stressed the importance of securing early supplies of a range of candidates. Meanwhile, U.S. President Donald Trump has again defended the use of hydroxychloroquine to ward off coronavirus, contradicting his own public health officials. He says the malaria medication was only rejected as a COVID-19 treatment because he had recommended its use.
I can only say that from my standpoint, and based on a lot of reading and a lot of knowledge about it, I think it could have a very positive impact in the early stages. And I don't think you lose anything by doing it. Other than politically, it doesn't seem to be too popular. You know why? Because I recommend it. When I recommend something, they like to say, don't use it.
North Korea is disinfecting the city of Pyongyang as the state introduces tougher curbs against the coronavirus after it locked down the town Kaesong on the border with the south to tackle what could be its first publicly confirmed infection. Strict quarantine measures and the screening of districts are in progress, and test kits, protective clothing, and medical equipment are also being supplied. That's according to the North's KCNA state news agency. And in the Middle East, the annual Hajj pilgrimage performed by Muslims all around the world is beginning in Saudi Arabia, but dramatically scaled back because of COVID-19. International visitors have been banned from making the journey to Mecca to try to curb the pandemic, and only 10,000 pilgrims are expected as opposed to about 2 million usually.
For more updates, take a look at our website. It has the latest news updates on the coronavirus pandemic. All you need to do is log on, access news and health, politics, business, sports, and several other stories. That's channelstv.com. That's the program this afternoon. Thank you for watching. I'm Millicent Nwaka. Stay safe, stay healthy.